So tonight we talk about your aching feet, your paw. Go ahead, buddy.
That's right. So tonight we're talking about plantar fasciitis. It's the most common symptom of pain on the bottom of the foot. And most of the
Yeah.
time you'll feel that pain on the arch or the medial side of the foot, and you'll feel it right into the heel. It occurs when the strong band of tissue known as the fascia there becomes inflamed and flattened out. Why? We'll get into that in just a second. So it's a long, thin band. It lies directly beneath the skin on the bottom of your foot, and it connects the heel to the front of the foot to support that healthy arch. It's designed to support and absorb the high stresses and strains that you place on the feet with every single step that you take. When these forces are not distributed properly, which is what we'll be speaking about this evening, it can lead to too much pressure on the arch, causing damage and tears to the tissue. And we're going to talk a little bit about that going forward
Ben,
here.
here's how we explain what the fascia is. Okay, so guys, imagine you had like this piece of flat meat, red meat right here, and you placed a piece of stretch and seal saran wrap right over that piece of meat, right? That piece of stretch and seal is the fascia. So all fascia is a piece of thin lining that lays right on top of the muscle. And what happens when you have inflammation, inflammation starts to infiltrate between these two layers right in through here, right? So go ahead there, Mr. Ben.
Yeah, so one of the key indications of this little, flat piece of fibrous tissue, I like to think it's like a spider web that ties all of your muscles together. When it gets really tight, it'll start to show on X-ray, just like when we saw that enlargement of the skull, enlargement of that EOP when you had the horn on your head.
Oh
You
yeah,
begin,
remember when you talk too much on your phone or you're texting too much and you grow a horn? That was episode like 3 or 4, I think.
3 or 4. And
Yeah.
so it's the same idea. So the plantar fascia begins to pull on that heel because that's where it inserts, right? And it'll actually cause tiny little bone spurs there on that middle aspect of your heel. And it'll present on x-ray as so. Key indication of poor distribution of energy with every step. And your plantar fascia is taking the brunt of that, and it shows on x-ray.
Now, Ben, do you treat an x-ray or do you treat the patient?
You always treat the patient.
Yes. So that said, that was a trick question, buddy. You struggled on that one. So that said, the reason I say that is because you cannot look at an x-ray like this and assume that this person has pain.
Yes, and you're exactly right, because actually 1 out of 20 people with these bone spurs don't have any sort of pain. And
Yeah.
so, or sorry, 1 out of the 20 people do have pain, the rest don't. And so the likelihood of you actually having pain with the heel spur is quite low.
And you know why I mentioned that is because many people get an x-ray, they had a heel spur, and then they give up, like nothing can be done, right? Because they think that's why they're in the pain that they're in. Big word here, kinetic chain.
Yeah. And so this is kind of what I'm talking about with the distribution of energy, right? And so if the energy isn't distributed properly, what you'll begin to see is a lot of that pressure being dissipated right on that plantar fascia. But then you'll also begin to see issues further up the chain, whether it be in the ankle, knee, hip, and low back.
So what about, Ben, that when we take a look at a patient, one of the first things that I do, and it's probably part of your routine as well in terms of being one of the first things you do, is you look at posture, because posture is the window to good health, right? So one of the first things that I look at from back to front is to see what is the angle of the shoulder, right? And then I go down to the hips and I see, okay, what are the hips doing? More often than not, wherever the shoulder is lower to, the opposite hip is lower, just like these arrows are already showing. I just wanted to use my pen there. So what happens then, you're going to get internal rotation of the knees, which then forces that foot to go down. So you can have the problem go from above down, or you can have problems because of your feet going from down to the higher chain, right? So just wanted to point that out. Go ahead, buddy.
Yeah, and so just like Dr. Roach said, and what I'm going to dive into a little bit deeper now is when you have that flat arch, the foot tends to tilt in because the arch is collapsed. The tibia, the next bone, like Dr. Roach said, internally rotates. What that does is it causes the knees to collapse into the middle. And so they would have then what we would call as a valgus, right? And at the same time, the pelvis, then the hip starts to internally rotate. And at that point, the low back becomes involved because you're further up that kinetic chain. Because we don't have proper hip motion at that time, then it leads to either back pain. It's always about looking at the distribution of energy. With every force that you take, the energy from the ground is going to be distributed up the body. And so we want to be able to make it so that the alignment of the structures can dissipate that force evenly and not just on one structure or another structure further up the chain.
Yeah. So take a look at all these joints being able to absorb the force. As soon as you walk and you hit the floor with your heel, all these forces go up the spine. So as soon as one of these joints is dysfunctional, and by definition, by dysfunctional, we mean doesn't have great range of motion in all those ranges, then all of a sudden it can't absorb the force. So it can't adapt to that force. And over time, things start to compensate. So now your hip goes lower, your shoulder goes lower. And the longer you go on with compensations, the more likely you are to have a non-traumatic injury. By definition, a non-traumatic injury shows up at Roach Chiropractic Center and Ben or Clayton asks you, how did this happen? And you just shake your head, or you shrug your shoulder and say, I have no idea, right? You did not get hit by a truck. You did not go in an accident. You didn't lift anything heavy. Just things start to fall apart because of the amount of time you spent compensating from these forces going up your spine, not being able to be distributed equally because these joints were not ready to support that force.
Yeah. And how many people walk in the office that just have plantar fascia pain? It's very rare that you suffer
Never.
from plantar fascia pain alone and don't have a knee issue or a low back issue. Just for example, today I treated plantar fascia. The individual had a tear in the knee on the exact same side, and most of his low back pain is originating from the same side as well. And so when you look at a history and you're picking apart and you're like, oh, there's something along the way that wasn't treated properly, or these biomechanical interactions were treated properly from the beginning. And so now we're seeing compensation patterns turning into injuries later on.
That's the only thing on the health history, though. Plantar fasciitis.
Yeah.
Do you happen to
And then
have
we
back
figure
pain?
everything
Oh,
else.
yeah, yeah, yeah. Yeah. How about neck pain? Oh, yeah, 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 yeah. Again, it just goes on
Oh, yeah. And I
and
forgot my
on.
knee. Yeah.
I
That's right.
forgot about the knee.
I had a
Yeah.
fracture back here. Yeah.
Yeah.
So you want to align the spine as well in consequent structures um, so that we can then have proper neural communication and force dissipation between the areas, right?
Yeah.
Result in decreased stress on the overall nervous system and responses to those ground reaction forces. And so if we align everything, the reaction will be proper and you'll have less pain, less injury, happy life.
So here's the truth. You may be able to solve the pain of the foot by just treating the foot, but you will never solve the whole kinetic chain by just treating the foot. Therefore, the pain in the foot will return if you don't address all these other issues. It ain't going to happen, right? So that's why we're not trying to avoid treating the foot. We just say there's a bigger fish to fry up here at the pelvis. And meanwhile, we'll work on the foot because maybe it's been like this for a long time and we need to be stretched and all that stuff. But yeah, definitely might not be the cause.
I just want to mention the x-rays just off to the side. So a lot of times these malalignments in structure and posture can welcome a lot of other things in the spine as well, especially if you've been doing these, you're taking 1,000 steps a day and you're taking 1,000 steps the exact same way. It can lead to changes in the actual anatomy. And you see it on x-ray where those arrows are pointing to. and they're pointing a lot to the arthritic structures, which are just posterior to the square vertebral bodies. And
Yeah.
so this is where a lot of arthritis will start in the facet joint, and we call it facet arthrosis. Where the arrows are pointing to are the white radio opaque areas, which become blurry. You should be able to see the nice lucid lines there, but because of the arthritis, it shows up on X-ray. Um, it turns out to be white and blurry. So I just want to make people aware that if alignment isn't proper and you're taking 1,000 steps the same way, the back is going to respond, even if you think it's just the foot involved.
Yeah. If you take a look at the, I just want to point something out, Ben. You were probably going to point this out, but if you take a look at the holes on the side X-ray right here, everything is great until you get here, and then this hole here is just obliterated, right?
Mm-hmm.
Is this the same X-ray, Ben?
They're meant to show the same thing
Same
at the
type of,
same level. Yeah.
yeah. And I mean, this is all white. So there's a lot of stuff happening here. And also, if you take a look at the disc space over here, which you guys have become professionals at by now, the disc spacing is very, very limited compared to what it is all the way up here. So again, this could be the simple effect of having bad foot mechanics affecting the knee, affecting the hip, or the foot could be the problem because of what's going on over here and how the pelvis is compensating. And now it's changing your gait every time you put your foot down on the floor. So what came first, the chicken or the egg? I guess at one point it doesn't really matter. They're both there and they both need to be addressed. So let's say we decide, okay, well, we got to treat the foot. What are some of the things that we can tell people to do for plantar fasciitis? I'll start with one. We'll kind of go back and forth. One of the things you can do, I want to go back to this here. One thing you will notice is over here, you'll have the Achilles tendon that'll be right here. Okay. The Achilles tendon ends right about there. And then the plantar fascia picks up right here and goes all the way down. So if your Achilles tendon is really, really tight, this will force your foot to curl in here and shorten the fascia and start pulling on the heel. So one of the things you can do is just, I'll show you how to do it over here, is to put your foot up against the wall and stretch the back of your calf, right? So that's going to be the back of your calf, stretch your calf, sorry. And the key here is to hold the stretch for 25 seconds to 30 seconds. Do it 3 times and do it 6 times a day. Morning, mid-morning, lunch, mid-afternoon, supper, and before you go to bed. Because most of the time stretching the fascia is not enough because you're deleting this part here, which is very, very closely associated down here. All right. So that's my thing. Go ahead, Ben.
Yeah, and the second thing that I would say as another quick point, if people feel this pain first thing in the morning, thumbs up if you feel plantar fascial pain first thing in the morning.
First
Okay?
step, always the most painful with plantar fascia.
Always the most painful. The first thing that you want to do is probably, if the pain is too much, get an ice bottle, a bottle of water, fill it up, put it in the fridge or in the freezer, freeze it, and roll your plantar fascia, roll your foot over the top of that frozen water bottle. It's a great way to help alleviate some of that pain with some ice. And as well, it sort of gets that foot rolling and it gets it moving in the morning.
Yeah. Another thing you can do is before you get up in the morning as well, once you've put your foot down on the floor and it hurts, you've now inflamed the area. So now you're backwards, right? And now you're trying to catch up and getting rid of the pain. So before you get out of bed, make sure that you, if this was you on the side and this is your foot, bring your foot up and down, up and down. So essentially what you're doing, you're stretching your calf, you're stretching your fascia, and you do 20 of these before you get up. Now you're ready to take that first step and hoping that, that should reduce a little bit of the tension that was there from you sleeping in the night and your toes somewhat relaxing, but keeping that fascia short. So when you go to stand, your foot's going to come down and it's going to stretch that fascia. It might not be ready to do that. So that's one more thing you can do. Go ahead, Ben. You got something else?
Yeah. Strictly speaking, if we're talking a lot about improving biomechanics, one of the first and major structures that I would look at is the hip. And so if you come and see us in clinic, I will take a look at the hip and attempt to change the structure there and improve its range of motion. And so you always want to improve upon hip internal rotation. It's one of the first movements to go as soon as you have a lower limb injury. And it's shown that if you have reduced hip internal rotation, it can lead to increases in ACL injuries, greater trochanteric pain syndrome,
So
hip
that's pain.
bursitis,
You got a, yeah, hip bursitis right on the
hip
side of the hip, right?
bursitis.
Yeah.
Yep. As well as plantar fascia pain. And so one of the main things is to have a stretch done, and we do that a little bit in clinic with some of our soft tissue techniques.
Yeah.
And that would be a huge one that I would recommend you seek help for.
Yeah. One more thing I recommend when people, when it's inflamed, do not walk barefoot in the house, right? You need a little bit of cushion there. So soft that you can wear in the house to try to heal and get rid of some of that inflammation as you're doing the other things. Because if you're doing the other things like putting ice and, like Ben said, the cold icy water ball, and you're doing your stretches, but then you walk throughout the whole day, because a lot of us are working from home now, barefoot on your hardwood floor. Well, that's just not gonna bode too well for your foot problem.
And don't be afraid to keep moving. This is actually a condition that gets better with movement.
Yeah.
And so you don't want to rest because of the pain. Keep yourself moving and avoid your feet curling up into a tight ball.
And then there's two things that we do in the clinic: active release technique, which we actually stretch the fascia, and we can also do laser therapy on the fascia. And one of the things we didn't mention, Ben, we can close with this here. These heel spurs go through two different phases. One is a calcified phase, and one is an ossified phase. The first part is calcification, but that is more soft bone, and it can actually be broken down with some soft tissue work. Now it hurts. I got patients like they'll be laying back, they'll be laying back, and I'm pushing on their heel, and they come right up. It's like, holy geez, what are you doing? But that can be broken down. Now, if it's an ossified cap, there's not much you can do to get rid of that heel spur. Now, again, it doesn't mean because you have a heel spur, that's because, that's why you have the pain. Because I've seen many plantar fasciitis case clear up and the bone spur is still there, but they have zero pain, right? So don't think that if you have a heel spur that's never going to get rid of the pain, right?
No, the pain can be treated without removing the heel spur. It does not have to be surgically repaired. The pain can be treated.
So here's a good question, Ben, Clayton. Are orthotics a band-aid or part of the solution? So I'll address it, and Ben, you can chime in, okay? I think at one point, if the foot has been pronated for so long and the ligaments have been stretched, you will not regain the stability and the structure that you need in the foot. So at that point, you may need an external device, meaning an orthotic, to prop the foot back up into supination, or get rid of the flat foot, so to speak, to help make the change to the knee and the hips. Now, however, I see a lot of people going to the orthotics prematurely, never even trying to solve the plantar fasciitis or the hip problem or the knee problem. So now people become dependent, and all you're doing, you know, everything looks great with the orthotics. As soon as you go, you take it out, it's still a mess. So it's almost, yeah, it is a band-aid at that point. So I always say treat the cause of the problem. And then if you need less of a correction on the orthotic, or now the orthotic will look different if you still need it maybe you don't need it at that point, but if you do, it'll look different if you've corrected some of the kinetic chain along the way.
And it's always great to be able to try things that are conservative before going for something that, you want to, I don't want to say depend on. It's just like a back brace, really, if you decide to use something to hold the structure together without trying to regain the strength yourself. I'll do techniques in clinic with some of my patients where we do exercises to help strengthen the arch. And
Yeah.
so if you have a flat arch and your arch is dipping, or you have a really tight arch, but it's not working properly, we try to address these issues, and they are solvable.
Yeah.
And so we always like to try these sort of things before we recommend an orthotic, although we have seen great results with people who have done orthotics, and they are a great tool to use. It's just a matter of when and what is the most beneficial time to use it.
And there was a question about massage therapy and acupuncture. Generic massage therapy on this, by the way, it's just not going to work. It needs to be specific, active. You need to bring the fascia and the foot through the range of motion. So you're actually getting the foot through the movement. You're going to get your results in that last 10% of the movement. So we're actually pushing the foot up as we're maintaining pressure on the heel. And you're going to get your results in that last 10% of the range of motion because you're working that insertion point where that arrow is right here. And if you're just lying there and you're just rubbing the foot, yeah, it might be good for your spouse to do that. You might get some bonus points and you'll love it, but it's not going to get rid of the plantar fascia. And acupuncture might dissipate a little bit of the inflammation, but again, it's not going to correct. A needle is never going to correct structure, right? So it might, again, alleviate some of the pain, but it's not going to fix the structure. Great questions tonight. Holy
Really great questions. I was about to say, I adjust through the actual first phalanx there. I adjust through that distal pharyngeal joint.
Here.
Yep, I adjust through there, and then I also adjust at the distal point as well.
Yeah, and that's a good point because what'll happen is the rear foot. So here's the calcaneus, and here's the talus, right? There's two bones in the rear foot, and here's the navicular, right?
Yep.
Yeah. These three bones here will determine what's happening over here. So a lot of people get pain right underneath the toes. The rear foot determines what the forefoot does. So getting chiropractic adjustments to help with the structure is going to be phenomenal. And most of the time, the arch is falling because of what's not happening back here, right? So don't discount the power of a chiropractic adjustment. We don't just adjust spines, we can adjust extremities as well, and the combination of everything else that we mentioned.
Yeah, for sure. And I always find people are always so surprised. I start doing palpation of the foot and I can tell where every single bone is. And then I go and I just take the big toe and I just whip it up and they hear a huge pack. They're like, oh my gosh, I've never had that release before. And then they have so much more movement through that big toe. Like, I've never thought I'd be able to have that much motion. You'd be surprised when you get things moving, how much better you feel.
And that's probably one of the most important things is that big toe extension. Your ability for the big toe to be able to go up has 100% correlation with back pain. So speaking of the kinetic chain, and unfortunately where people get arthritis in the feet is in that first big toe, right? So you lose that mobility, your gait is thrown off, and all of a sudden now you find yourself with plantar fasciitis, but more importantly, back pain, right? Again, vitamin of the month, vitamin D3.
Yeah, great vitamin. We've had a lot of people come in and ask us about the vitamin D3 with K2 drops. Awesome, great, good job looking into it. You see the benefits here. Natural sources, salmon, sardines, egg yolk, shrimp, yogurt, orange juice, and of course the sun, which we're supposed to get a lot of it this week, hopefully. And we'd like to thank everyone who's taken the recommendation for magnesium as well. You see a lot of people coming into the clinic and you're seeing the benefit, and especially with these orthomolecular products. They have a really strong absorption rate and they are a great product. See great results.
Please just go ahead and click the share button. Make sure you like our page. If you're not following us on Facebook, there's a difference between liking and following. Following, you're actually going to get notifications that we're live. Liking, you just get the posts, right? And if you're watching us on YouTube, make sure you subscribe, and that way you get the new episodes as they're posted. Guys, I really appreciate everyone that's chiming in, and the questions were amazing tonight, by the way. We love this. It spices it up a little bit, right? So thank you so much. We appreciate you, and we will see you 2 weeks' time. Hump Day Conversation. It'll be episode number 16.
Awesome, guys.
All right.
Awesome.
Cheers, y'all. Take care. See ya. Bye-bye.
Thanks. Bye-bye.
What's up, guys? Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good, so here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys are live. Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.